Well, it's 12:30 and a good afternoon to you here on the Deli and the Cafe. Brian Dust, are you enjoying your Rusty Reel Lake Jam
We
cafe?
are. Yeah, absolutely. Got some great calls in on Cooper Allen coming up here.
Very good.
Did some big and rich people wanted to hear. All good.
All right, glad to hear it. Glad to hear.
Yes.
I'm doing a new wave deli, so it's been pretty cool. Like I'm enjoying it. I don't know if anybody else is, but I'm really enjoying it.
New wave, but in the past.
Yes, yeah. It's back in the late 70s, early 80s, new wave.
I love that stuff.
That I grew up, XTC, and
Oh, yeah.
and I got music on the way from In Excess, some of the really early stuff. And I just played Real Wild One from Iggy Pop for
I remember
Dr. April Ritz, because she is the real wild one.
Real wild.
In the bed at 8:30, right?
Yeah. I was just telling her I like to be in bed by 8:30, 9 o'clock.
Nothing wrong with that.
Yes, indeed. Hey, it's good to have you here. We're on Facebook Live. You want to check this out, and you're a busy girl. Got lots of things happening, I'm sure. What have you been doing lately at F&M Pelvic and Wellness?
Well, number one, treating patients. Number two, preparing for our upcoming events and classes. So,
Keeps you busy, I guess?
yes, it does, for sure.
All right. So what do you want to talk about first? Kind of curious.
First thing is just some conditions that we've treated this past week, so people kind of get an idea of the wide scope of patients we see and what we can help.
This could be great. Who knows what all you're checking out? Huh?
Yes. So we've had several patients the past few weeks who have came to us from chiropractors or GI doctors or their primary care doctors, just because they aren't able to get like the underlying results addressed. We had a lady walk in that's been dealing with severe pelvic pain, numbness, tingling into her inner thighs too. That started about 2 months ago, and she called us. I'm coming to your clinic right now. I need to get scheduled. And she's like, I just left the chiropractor, and he told me that maybe you can help. So we're working with her now. We've had some patients coming from GI specialists that they're. Have you guys ever heard of toilet refusal syndrome?
No,
I have not.
So it's typically when kids that refuse to use a toilet. So
really? That makes sense.
yeah, and these are grade school age kids,
So
elementary school.
They
Yeah,
should be there.
yep, they're past that 3-year-old
Yeah.
stage. They should be able to fully function and use a toilet for peeing and pooping. And this is actually a very common thing we see with constipation.
Okay.
So these kids are in school and they refuse to use the toilet to poop.
So they just hold it in.
They hold it.
That
Yep.
is not a healthy thing.
Yeah, so the parents are super stressed and they're like, we need to get to the end, we need to figure out what's going on. So working with them, of course, urinary leakage is about a daily thing we see, and urinary urgency, pain with prolonged sitting, pain with intimacy, pelvic organ prolapse for women when their bladder starts to fall, or their uterus or vaginal canal starts to fall in if they've had a hysterectomy. Number one treatment for that is pelvic floor physical therapy, unless it's already kind of starting to come out of their body.
Okay.
And that's beyond us.
So we need to do something else there.
Yes. We have some just basic hip pain, low back pain, SI pain, and then we've also had a couple women in the past week with their second and third trimester for pregnancy.
Okay.
So
you cover a lot of there.
yeah.
Man, no kidding.
Yeah.
Let's go back to
And that's just a few.
let's go back to the first one you talked about, the lady that came in.
Yeah.
And just have you figured out what the problem is? Kind of curious.
Yeah, I typically, if we just listen to the patient, just listen to him long enough, we can figure out exactly what's going on. So, and then of course we do our assessment, and then that confirms what we're thinking. But, so there's a nerve in the pelvic floor called a pudendal nerve. A lot of people don't know about it, but it supplies that area and for motor and sensory. So functioning of the muscles, but also sensation. And we think that nerve is being compressed and pelvic floor overactivity. So like I said before on the radio, a lot of our patients think I need to be doing Kegels. That is not true. Not all women should be doing Kegels. We need to be focusing on relaxation. So in particular, this patient, muscles are super tight, intense, and painful. So working on those muscles, getting them to release, reducing stress in the overall body, and getting that nerve so it's not as compressed, and relaxing that area will help with her pain.
Well, that's interesting.
Let's hope.
Yep.
Yeah,
Right
it's
on.
usually like tighten things up.
Yeah.
Not necessarily.
Yes, that's a true and false I always do at some of our community events is every woman should be doing Kegels, and a lot of people say yes, and I'm like, no, that is not the case. Exactly.
Do you ever do that? Wrong answer. I think you should
I
start doing
don't,
that.
but maybe I will.
I like that. Tell them Flex said to say,
Oh, yeah. That'll go well.
Yeah. but it's amazing that you're helping all these different people out.
Yes.
And it's got to make you feel good when you and it's really got to make them feel good when they're like, oh, I can do this and get her fixed.
Yeah, people always joke like, I'm like, I don't know how you do your job. Do you really like doing this? And I'm like, some of the things I don't necessarily like doing, like I don't necessarily like doing internal rectal treatments, but the long result, like getting these patients better when they don't have anywhere else to go, I do like
Yeah.
helping
Okay.
them get to the end goal.
It's worth it.
It's worth it.
in
It's
the
worth
long
it.
run.
Results.
Yeah, and another thing I wanted to mention too is that we are offering dry needling at our clinic now too. So
All right.
Dr. Katie
Ah.
is back with us, and she does dry needling for really any part of the body, whether it's neck headaches, shoulder pain, hip pain, butt pain. She does dry needling, so that is something that we're seeing patients for. Even if they're not having a pelvic floor issue, but just want to get in for dry needling, Katie can see them for
I'll
that.
be darned. Well, that's awesome stuff. So
Yes.
you just keep doing more and more and fixing up more and more people. That's a good thing. That's what you're here for, right?
Yep. Hopefully, everybody walks around with good, healthy pelvises in our town.
That's right.
Well, you hope so.
The most healthiest pelvis place in town, Pilgrim.
That's a sign coming into town.
Yeah. That would be awesome.
Get a
We need to
billboard for that.
Yeah.
Well, we got a state champion of golf, and we got the best pelvises in town, baby. All right.
But you guys work with a lot of things. One of the things you mentioned there, and I think you want to talk about that a little bit, is something that is every day of the year issues for some people. What do you call it? Urgency.
Yeah, urinary urgency.
Urgency.
And with that can come incontinence.
Yes.
Okay.
Tied in, maybe.
Neither one is good.
Yeah, so we do see a lot of people with urinary urgency issues. People often think, like, if they're dealing with these bladder issues, like,
Mhm.
most people, their mind goes straight to first thing I need to see is a urologist. But we are trying to kind of turn that around a little bit. Like, urology definitely has its place, like, for medications and surgery, but basic things like overactive bladder, urinary urgency, urinary leakage, bladder
Mhm.
prolapse, like, the basic stuff we can treat in our clinic conservatively without having to go to be put on meds or thinking about surgery. So urinary urgency, we see a lot of this in the clinic. Just had a couple patients this morning I actually worked with
Yep.
on this. So basics for people out there dealing with urinary urgency. Number one thing is, what are you drinking?
Okay.
Water is very important. Everybody thinks, like, if I drink more water, though, I'm going to be peeing more and my urgency is going to get worse.
Okay.
If you go from 1 bottle of water a day to 4 a day, yes.
That could be a
yes,
that
that's
could be a big difference.
yeah, it's going to be worse. But we slowly increase water intake with patients, and I explain to them our bladder in the lining has chemical receptors and stretch receptors. So regarding chemical receptors, if we're not drinking water and all we have is coffee in our urine or
Yeah.
tea, that's going to irritate those chemical receptors. We need the
Ah.
water to dilute the urine, and that will help reduce the urgency. And then also, if they're drinking coffee or whatever, or going off that, decaf coffee is still a bladder irritant.
Oh,
So
really?
everybody thinks, well, I'm drinking decaf coffee.
Oh.
And I'm like, nope,
Okay.
still an irritant, still an
Yep.
irritant.
Yeah,
So
the only good thing about coffee is that if it has caffeine in it, for crying out loud.
yes, I don't know why you would drink it otherwise. But so yeah, I tell people, watch your fluid intake, increase your water, reduce your other fluids such as coffee, soda, teas, artificial sweeteners
Oh.
are one, and for some people, red and blue dyes are an irritant too.
Oh.
So I actually, just kind of fun fact, I saw California. One good thing that they might be doing is
Yeah.
they may be eliminating red dyes
I
in
saw
their
that. Yep.
foods.
I think
And
that's a great idea.
The whole U.S. needs to be doing that.
Yeah.
Like Europe doesn't allow dyes, but dyes affect our kids' behavior, affects urinary issues, but that's a whole other thing.
Yeah, we could go on and
But
on.
but yeah, so if you've tried increasing water, reducing your bladder irritants, and then honestly, when you get a strong urge, just sitting there doing some deep belly and rib cage breathing. So for breathing, I tell people you shouldn't be like lifting up at your shoulders when you breathe in. We want all like abdomen and the rib cage expanding out when you take a deep breath in. And doing that 5 times will calm down our nervous system and the nerves through the bladder.
Ah.
So to reduce that urgency. So then you can get up and walk calmly to the bathroom.
And will your bodies kind of relate to that in the long run,
Yes.
doing those breathing, and then maybe you won't even
Really?
have that, huh?
It gets easier and easier. I actually have a 5-step process for patients dealing with urgency of basic tips. and I have them practice it even when they don't have the urge. So a lot of people like pulling into their driveway or getting out of their car in the garage. All of a sudden, the urge hits them, and they
Yeah.
like, oh, I can't make it inside in time,
Oh,
or
no.
opening the door into their house. And I make them practice the steps even when they don't have the urge. So sit in
Ah.
your car when you feel fine, so you get used to doing those steps, and your mind's not like, I'm gonna pee, I'm gonna pee, I'm gonna pee. Sit there and practice it so you feel confident, and then when those urges do come, you're like, okay, I know what I'm gonna do. I'm gonna sit here calmly. I'm gonna do some deep breathing, and there's some other parts that go with that. But that's something we work in the clinic with. And then if those basic things don't help, we've had people come in the clinic and we literally within one visit they're fine
Oh,
because
wow.
it's just the basic things they
Mhm.
need. A lot of our patients need a lot more than that. Talking about the pelvic floor overactivity, sometimes the pelvic floor is overactive, affecting the nerves to the bladder, and releasing those muscles can also then help reduce the urgency. And then we're also addressing any stress they may have, any hip muscle issues. It's not just simple like change your fluid intake. It is for
Yeah.
some people, but a lot of people in the clinic, it's a lot more than that we're working
I
on.
believe it.
Yeah. So if you got any of those problems, get a hold of the clinic,
Yes.
and maybe we can point you in the right direction. Got any classes coming up in the next few weeks?
Yeah, it's a busy. I was just talking in the clinic. We have the next 4 weeks, we have a class per week. So
Oh, okay.
I normally don't like to do it that way, but that's just how it fell.
That's the way it
Yep.
worked.
So next Wednesday, October 18th, we have a few spots left in our preteens, teens menstrual health class. This is
Okay.
a class for 10-year-olds to 17-year-olds to come with their mom or grandmother or whoever.
Mhm.
Come to this class and we go over all the basics. It's a 2-hour class. And then the following Wednesday, we have our class for adults, and it goes into more depth on like infertility issues, PCOS, endometriosis, conditions like that, different ways to try to get off birth control, because birth control really is not a true period when you're on birth control.
Mhm.
There's a lot of side effects from that. So we go into a lot of depth on that, and that is on Wednesday, October 25th. And we do still have some openings for that class as well. Both of the classes are $25 to attend. You can go to our Facebook page and find more information, or just call our clinic and we can get you registered. And then the week after that, the first week of November, November 2nd, we're having our 2-year anniversary party.
Oh, there you are.
Wow.
And I'm really excited. We're going to have some pretty sweet cookies that
Ah.
have some funny pelvic health things
Oh,
on
my
them.
Awesome.
goodness.
And then we're gonna have some gift bag giveaways and things. And then we're also offering free screens throughout November through our clinic, and it's like in-depth screens more than what we've typically done. So those are free. Go to our Facebook page for more information on that. And then the week after that, November 9th, we have our Midwifery 101 class. We have 2 midwives coming in talking just about midwifery and for those interested in home births. So we actually see quite a bit of women in our clinic that are doing home births and a lot of moms who are interested. So come to that event. That event is free to attend, and all of this is on our Facebook page, which is Effingham Pelvic Health. And you can follow us on Facebook, Instagram, or YouTube now.
Oh,
at-
YouTube channel.
Yeah,
Awesome.
we got YouTube
Nice.
now.
Should I
it's-
send you this video now?
Yes, go ahead.
Okay,
Send it
I'll
right
send
now.
it.
Send it
I'll
right
do
now.
it.
So all of these videos go on there now, and then just like some basic exercises we give our patients, just things that our patients often need more instruction on when they get home, so they can go to our YouTube
Yeah.
page and find this information.
Very good. Well,
Yes.
awesome. Well, it looks
Man.
like you got your hands full. Absolutely.
No kidding. Could
Yeah.
you squeeze some more classes in, maybe?
We are so I'm working on with Amanda Settle Nutrition Wise on
Yeah.
a constipation class for diet and pelvic floor,
Oh.
as well as IBS class. And then I'm working with a midwife and an APRN or advanced practice nurse on a menopause class. So
Okay.
that is coming hopefully in January.
All right.
Yes.
Why don't you
Um,
just open up a college?
I do actually I did want to go
Professor.
into education and teaching. So
Ah.
doing these classes kind of fulfills that
Okay.
desire inside of me. But
Awesome
yeah.
stuff. Well, keep doing what you're doing, no doubt about it.
kidding.
A lot of people are interested. A lot of people have been helped from you, and everybody at the clinic. Keep going doing what you're doing. Okay?
Thank you.
Yeah.
All right, very good. So good stuff indeed. Brian Dust, we're going to have a good one on the drive home tonight.
I hear that rumor.
Yeah, a little interview with Brett Michaels at 4:30.
Oh, fun.
Don't miss it, folks.